I'm not going to show that right now, but you go back here and there's a little flap. Actually, I think I better show it because this one's weird.
What's up, Rich? Hey, how's it going?
Joel, you'll need to make sure we're lined back up again after I do this.
I did.
So here's the on-off switch. It's got this little plastic flap. You got to flip that up, and then you can turn it on. CO2 detector. All the vents that have them now have CO2 detectors, inline ET CO2s with them. I don't know how to use this yet, so that probably shouldn't be on tape, but oh well. That's okay. Sometimes I'll have to learn with you guys because we haven't had these adapters here before, and I don't go to a hospital that uses the Dräger, so we'll have to calibrate it and put it in line, but that's okay because we will. So that's that. And all of our other, if things don't plug in or turn on, sometimes you got to check your connection. It's in the back, as we all should know by now.
You have to switch.
Can you get that wheel for me, please? Are you good?
Miss Foss, what are the?
I can't tell because you got tape over the top of it.
They're filters. Yep. Are you good?
Yeah.
Joel, come check. There's no point in you recording if you don't get a good video.
Let me
This is
take
for you
one look
guys.
here. It's okay.
All right. Who knows how to turn the air in the O2 tanks on? Anybody in here?
Let's find out. It's just the manifold. You gotta do a little.
Yeah, all you got to do is open up the valve. Okay, so
We're all going to blow. It only blows up.
all you got to do is open the valve on the tank. Takes 3 of you? Really?
How many students does
How
it
many
take?
students does it take to turn on the oxygen?
He
Yes.
asked me to come with him.
The supervisor? You need the key. Okay, so when you turn it on, if you go here to start and standby, and then, I know. And it says to enter standby, touch screen key, standby and confirm. So we're going to touch it. It turns yellow. You have to push this to accept. It's not in standby until you actually do alarm reset and then push the button again. Now it's actually in standby because like the other vents, it wants you to confirm that you really want it to be in standby. From this screen is where we will do our calibration on this ventilator. So they have the check button. We also have oxygen, humidifier, tube, and mask, but we're going to go to the check button. And when you go to the check button, you'll see device check and airtight check. And you'll also see when they were done last. So you see this was last done yesterday. The last airtight check, which checks for leakage.
Is it on? What's this?
I hear that noise. Are you blowing us up? It's either, did the gauge go up?
Yeah,
I saw the pressure go up.
Yeah, all 4 of the little valves on the top, I turned it. 2 of them say ready, 2 of them say in use.
That's fine. Did you turn the air on?
Yes.
Okay, then we're good.
I want to double check.
It's only it's just like a wrench on an E-tank. It's no different. It's just big
It was
tanks.
actually pretty complicated, guys. Don't worry.
Okay, so from this screen then we can go to our calibration. So device check is where you'll go first. And when you go here, it's going to go through the different things we're going to check. Up at the top is the blue. The blue guides you along everything you have to do for the calibration. So it's very important. You need to be able to read that, what it says, and do what it do what it tells you to do. So, so right now, once this hit reset, so we did. Okay, because it won't let you do the calibration if you have an alarm up there. So you got to have that going. So now we're going to go through our check. So we'll start by hitting the word check, and it says check current position of the exhalation valve. This here is the exhalation valve. This has a, this here, the wrong knob. It has a little blue tab here you have to push in to pull it out, and you also have to, on this flap is the flow sensor. If you pull this out without moving the flow sensor will fly across the room and can break. So it's important because the flow sensor actually pushes into the side of the exhalation valve. So it's important to just pull it out slightly by pulling it to the left, and then you can pull your exhalation valve out. This is the exhalation valve on the Dräger. Like it has a, you have to turn this. to open to find the mushroom valve in this one. If this is not tight enough, the ventilator won't work. It makes this obnoxious sound. Kind of like the ambu bag does when it makes that loud sound. This does the same thing. So you want to make sure that this is, if you're having problems with it cycling into inhalation and exhalation, you want to check this and make sure this is okay. It doesn't have any moisture on it or that this is screwed in tight enough. So we're just going to take it. And sometimes it's screwed in so tight it's really hard to unscrew. And then we're going to put it back. This faces this way because this is where the flow sensor is going to butt up next to. So when you put this in, you just go there and you can hear it click into place. Our flow sensor is like the flow sensor on the Galileo, except it's different. It looks different. It has little gold little spikes in there that are used to check the flow in here. If this is not working, the ventilator won't work. You'll get check flow sensor errors. So this needs to be working and in good order. If not, you have to replace it. And you'll see it has words on it, so just put the words so that you can read them so it's going in the right way. And it actually will go into, you'll see a place where it'll fit right into place there. So we're going to pop that into place. And then it slides over to go into the exhalation valve, and this has to be closed. Sounds a little technical that has to be closed, but it does. So now we're going through and it's saying neo flow sensor placed at the Y piece. We're going to say no because we do not have a neonatal flow sensor because we're not ventilating neonates right now. So we're going to say no. And then we're going to go to next test. And then you do check. Hold on, it went too far. I'm going to start this over. Okay, so after we did that, I messed up. I was supposed to hit yes. So now I hit yes, so it's going to go to the next one. So now it says connect test lung to Y piece and then confirm with yes. So it's telling us exactly what to do.
Gotta get a new one.
Connect test lung. Once you've done, then it says confirm with yes. So now we say yes. And now it says check is active, please wait. Check correct position of the flow sensor. It just wants you to confirm that it's in the right position, in the right way with the door closed. So we've done that. So then we hit yes. Neo sensor placed at the Y piece? No, because we don't have a neonatal. Is humidifier ready for use? If we have a humidifier hooked up, then we need to say yes. Otherwise, we're going to say no because we don't have one right now. Are the patient hoses correctly connected? Ugh. Yes. So now we're going to say yes. Connect test lung to Y piece, confirm with yes. Connect air supply, disconnect oxygen supply. So now we'll disconnect our O2. And then it's going to start its check. Just do exactly what it tells you to do. Check is active, please wait. Connect oxygen supply, disconnect air. Check is active, please wait. Connect air and oxygen. Audible alarm sound check. Confirm with yes. When confirm with yes, we're confirming that we hear it.
Oh yeah, we do.
Yes, we do. Flow calibration, then it says calibration okay. So we know that's good. Disconnect, seal neo flow sensor, press button. We're going to do next test because we don't want to calibrate our neo flow sensor because we're not using one. So it says aborted, which is okay. Now it's doing its O2 calibration. Still doing it. Calibration okay? Now it says position CO2 for calibration per instructions.
It's over here.
Thank you. Normally, they have, there it is. Yeah. So the CO2 sensors usually have this on there of some sort. So down here it is. So when you're going to put it for calibration, you're going to, let's see, it's got to go. You put that in place like that, slide it in there, and then, and see it says CO2 sensor fitted into cuvette. So yes, it's in there right now, and we're going to say yes. Oh, it didn't zero it, but that's okay. We'll figure it out. And now it's got a check mark. We know when it has a check mark, we're good. So this is done now. That wasn't calibrated perfectly, but you get the idea. Thank you. Now you have to go to the airtight check, because that is going to check for a leak. It's like the tightness test on the Galileo. So you're going to take off your test lung, put your hand over it, and hit check. Seal Y piece, confirm with yes. Check is active, please wait, up there in the blue. It's also figuring out the compliance and resistance of the circuit as well, like the other ones do, like the compressible volume, it's the same thing. Keep Y piece open, so now we're going to do that and confirm with yes. We have check is active, please wait again. And when all that goes away, as long as it's done. If you get a message, it'll tell you there's an error. So otherwise, you're done at this point. So now if we go back to our new patient, we can set it up if we wanted to. There's adult, pediatric, neonatal again, ideal body weight, which no, we don't use. And it tells you what is currently set. So we're going to go to adult. Adult. Sometimes the screens are a little funny on this one. Adult. Come on. Okay. It wanted me to confirm it. And then start, and then the start will turn yellow. So once you did whatever you wanted to do right here, then hit start, and we'll go into ventilation. And we'll start ventilating. Alarm silence, the button's over here. A lot of this ventilator has a lot of buttons that go to the same places. So there might be a button over here. Huh?
Question mark.
We told it had a CO2 sensor, so it's looking for it. That's why I did that. Once it's blue, once the alarm up here is blue, that's the alarm that had gone off, and so you just do reset and then confirm to make it go away. Like the other vents, you got red alarms. Those are your high priority. Make sure you do something quickly if you get a red alarm. Yellow or not so priority, but of course still important. So here are some quick keys. You can make some changes. You push it. Yellow means that you can change the setting on it, the dial. And if you do not hit confirm and you go away, it will stay at where you set it, where it was. You must hit this button over here if that's the confirm button. So if we wanted to go down to 75, we push it.
Bless you.
Thank you. And then go down to 75 and then hit confirm. Now it will take it. This is the confirm button. So our alarm silence, this is where we can set our alarms. This one just has high minute ventilation, low minute ventilation, high pressure, tidal volume, excuse me, high tidal volume, high rate, and apnea. Those are the only alarms on this ventilator. And then vent settings. What are we? Okay, let's fix something because something. Let's see. Yeah, I knew that was going to happen. Yeah, when we're actually, obviously, they can't register as CO2 because we don't have a person hooked up to it. But it's important that you guys learn how to work with these, so that's why I wanted them. So we'll just have to deal with that alarm. And once you feel comfortable with it, then you don't need to use it. But if you haven't used them before, then you need to be comfortable with calibrating them and using them. And I'm sure it could end up on the final. So I won't do it on the midterm since we just got them. So, all right. So ventilator settings, we can actually go to the different modes and settings that we want. So CMV is what? AC. It's assist control. CMV by itself, just the word CMV, is ACVC on this ventilator. Welcome to the funky names. You have it on here. One nice thing about this vent, if you don't know, it's kind of the PB has them too. If you don't know what something is, you can hit the question mark and a nice little screen will come up and tell you exactly what it is.
Can we use that on our midterm?
No.
Oh.
No, you cannot. So it'll tell you all the different modes and what they are and what they do. So PCV plus is ACPC.
PCDC.
No, it's SIMV pressure control. Excuse me. PCV plus is SIMV pressure control mode. PCV pressure control ventilation. So you'll be able to set, and you can, if you really pay attention to what you can set, you guys, if you think about the modes, you'll know even if you can't remember, because here we can set our O2, our inspiratory time, our frequency. Slope is like the rise time, same as the ramp. Our peak inspiratory pressure that we want on our breath, PEEP, and then pressure support. It has to be SIMV pressure control because we're setting a pressure and we have pressure support. We can't have pressure support in assist control. Does that make sense?
Yes.
So if you're unsure, just look at what you can set, think through the modes, and then you'll be able to figure out which one it is. SIMV is SIMV volume control. CPAP pressure support. We have a place for our pressure support and our PEEP and our slope. PCV plus assist is ACPC.
So,
PCV plus assist. The word assist, think assist control, pressure control. Here you see we can set our inspiratory, our peak inspiratory pressure, inspiratory time, our frequency, our slope, and our PEEP and our O2. That's ACPC. There's everything we would need to set in ACPC. There's no pressure support, so it can't be SIMV. If we wanted to get crazy, we could go to more. APRV is like bi-level on this ventilator. It will do the same thing. High, two CPAPs, long I time, short E time. This just lets you show, it automatically shows these four, and this screen lets you show PCV plus assist. So if something happens that it's not there, now look, I come over, I see MVV, I don't see PCV plus assist. It's because I have it set to show something else. So if you come over to the vent and you don't see PCV plus assist or one of the modes you're looking for, just go to the More tab and fix the one, get the one that you want to be showing, push it, set it, and then hit accept.
Is there a PRVC on this?
Yes, there is a PRVC. If you go to CMV and go to additional settings and go to auto flow.
Wow.
I know, wow.
Dräger.
So
4 by 11, right? What was it? Additional settings and then what?
Auto flow.
Why can't they just all be PVA 40?
Because it's not that easy.
It needs to be a monopoly in the ventilator.
You have this down, working with it?
Oh my god, get it out.
No, you're working with this one though, right? You do vent checks on this one, right?
Yeah.
Is it okay? Easy?
Well, what's your basis of comparison?
But it makes sense though. Which hospital? It's always
I didn't mean
just
that
a
conversation.
pressure to get a needed volume.
Like right now, the one that is on the side still is the
Yeah, Georgia is really quiet.
It's not really.
Her boyfriend
Double
is
being
not
quiet.
triggered. Hers, it's like the opposite, like Rowena.
I'm thinking it's automatically giving the right flows.
She's quiet. But her boyfriend is not.
But now you remember.
Yeah, her boyfriend told her. The first time I met her, that's what he knew me forever. I was like, oh, really?
I may not
When you girl.
So is this the hardest one?
It's people have trouble with this one because the names are so different. It's not that it's any harder, it's that the names are very different than the other things. So you have to remember.
Well, especially when you're just learning them anyways.
Exactly.
To get thrown off a derailment.
Right now I'm in PRVC. It's CMV mode without autoflow on. You have to look at the autoflow. And you can see right now I can set my pressure max, my tidal volume that I want. It's the only way, it's the only one that lets you do that.
So autoflow has to be off.
Yes.
So no autoflow.
So cause watch, so now we can set tidal volume, our max pressure, all the things we would want to do if we were in PRVC. So now if we go back over to settings, oh excuse me, autoflow on. Yeah, I said it backwards, I apologize. Autoflow on gives you PRVC. Ronald, correct me if I say something wrong. He was telling you all Mrs. Fox is wrong. Huh? Anyways, you need to have autoflow on and then you will be in PRVC mode. So as soon as you turn that on, then you'll be able to come over here and set your max pressure and your target tidal volume that you want. And if you turn it off, wait a minute, go back. Anyways, now we don't have those settings anymore. So you can't set your max pressure. And there's also no, and then we also, yep, that's it. So that's how you get to PRVC here. The other things, if you want to mess around with like what waveforms show up on the screen, because sometimes when you come over to the screen it's kind of funky. So if you want to show what waveforms are up here, you just change that over here. You can freeze it. So we could do trends. Here, this is showing a flow waveform right now. If we want to do a loop, then we can see loops. This one has a really nice option actually where you can make changes and it'll show you the old versus the new. So if you wanted to increase this patient's compliance, I think I can do it just by holding it. So see right now it's nice and tall and kind of at this angle. I know we haven't covered waveforms yet, but it's kind of like going this. This tells us we're at a low pressure, because if I was at a high pressure, I'd be going way out this way. Because this is pressure and this is volume on this waveform here. So on this one in particularly, we wanted to have a nice tall like this, because that tells us we have a low pressure, and because it's tall, it's telling us we have a nice tidal volume, a good tidal volume. When our compliance decreases, you'll see that go out to the right. So because that means our pressure's higher and our volume's lower. So,
Oh, I know. That makes sense.
see how it's going way more to the right? Mm-hmm. So we don't want to see that. That means our patient's got a lot of compliance problems going on. So anyways, you can change what you see on the screen, and if you have someone who has a compliance problem, it's probably not a bad idea to have that up there, because you can visually, just by looking at your ventilator screen, that's the nice thing I was telling you guys about waveforms. You can visually see a lot of information without having to go very far. So if you have a patient who's having compliance problems, that's probably something, because if you're seeing this and they had compliance problems, hey, they're doing a lot better. Yes?
What if, I heard someone say something about a beak. If there's a beak on it, you have to make an adjustment.
Yeah, if there's a beak on it, that means that you're overshooting your tidal volume.
So that's like they're already maxed out, and that's kind of like
Right, because it's not going anywhere. So it's maxed out. You get the beak. So if you have this loop that comes out like this, when you have a loop, it's saying we got nice things going on because a little bit of a curve. I'm getting some volume in. If you get the beak, it's because it kind of plateaus. You're not getting any more volume in, even though you're still putting pressure in.
I see. Okay, so it makes sense.
Yep. So if you see a beak, that's worse than that. That's almost kind of one on there. Look at. See that spot right there? There's kind of almost one right on here because this lungs, I'm putting a lot of volume in it. So really, this point here is the max volume this patient should be getting. So that's telling you you need to back off on your tidal volume.
And then what about the figure 8 thing that sometimes I'll see on that?
I don't know why the figure 8 goes at the end. At the beginning, you get a figure 8 if a patient is spontaneously breathing because they're pulling back into the negative.
Oh.
So you'll see it go back here, loop, and then go into your positive pressure breath. All right, sensor parameters. Here's where we can do a calibration if we needed to do a manual calibration for our flow sensor. And then we can do an O2 calibration and a CO2 calibration if we wanted to calibrate we don't have to go back to that beginning screen. You can do them there. System setup we won't worry about. Then over here, main, that's just going to put you on whatever your main one is. Data, this is where you can get all your patient data from for your vent settings. Special procedure, O2 suction, right there. And sometimes, yep, it's right here too, O2 suction. So it's right here as well. Let's see, there's a nebulizer one if you wanted to use this. Inspiratory hold and expiratory hold, that's where you'll find those for doing your compliance and resistance. And there's also one on the right, but there is not always. It depends on which ventilator, which screen, which graph you have. And then here's where you can get more patient data as well. You know, you have, this has got the most important, our frequency, our XL tidal volume, minute ventilation. This data one gives you the detailed, and there's lots of tables you can go to for all the different things. Then you can also see more here too by pressing this. We'll put different things on the screen depending on what you want to look at. That's what's going to stay up all the time. So this one is nice because it has our tidal volumes, our minute ventilation, peak, mean, plateaus, resistance, and compliance all right there. So if you don't see, if you do your inspiratory and your expiratory hold and you don't see your compliance, then you need to just push that 1, 2, 3 button to go to another screen to find it.
And there's a data thing too on there, right?
Yeah, that's the data one was the one I already showed. That's here as well, right. That's why I was saying there's multiple ways in multiple places you can get the information from on this ventilator. Let's see. I think that's pretty much everything. Are there any questions?
So for the pre-use check or calibration, it requires specifically a test law.
This one does, yes. And this one's called the device check.
So that for the midterm, we would have to get the test lines? Or
Yes,
have it
we'll
out?
have it out.
Okay.
Yep.
No?
So remember, stand by, push the button, hits the standby, confirm, then alarm reset and confirm again to actually get it into standby. So no questions?
On the plateau on this one, it's automatically calculated for you, right? Like you don't have to push like
You have to do it.
No, you have to do an inspiratory hold. You can never get a plateau without doing an inspiratory hold. So you always have to do that. It's just special procedures, and there's also a button right on the screen for it as well.
Did you just calculate compliance or
Sorry.
resistance? I'm sorry.
Most of the time, it's finicky like the other ones. But for the midterm, you guys, you can write down the compliance, but don't be surprised if I ask you what the calculation is, because you still need to know how to calculate it. Because ventilators don't always give us the numbers what we want, so sometimes we have to manually calculate them.
I didn't know any of them gave it to you.
Huh?
It gives you the actual. They do?
Yeah,
I didn't calculate it. I didn't know they did it.
yeah, they do.
Yeah, they do.
Plus
All of them have a place for compliance. What's that?
Oh, we calculated it ourselves.
On the lab portion, yes, you can use a calculator. I do allow it on that because that's the only time. Yeah, because we're not there for an hour, and there's time limits, and it's